Hi everyone, today we're going to look up about the management options that we have for a patient who is presenting with ureteric colic after the patient gets admitted to the ward. We're going to look up into the immediate management principles that we do in this patient. So the first thing we do is a pain management. The patient will present with severe amount of pain which will make the patient really anxious and nauseated and vomiting. So we can give diclofenac suppositories. This diclofenac suppository can cause adequate amount of pain relief. You will see a dramatic amount of change in these patients when you give diclofenac suppository. They will feel better. But in some conditions you can give diclofenac suppository. You can go for pethidine or penagan, anything like that. The pethidine can be given IM as well. It can be also, both choices can be also made when the patient was complaining a persistent amount of pain. So the next complaint will be the patient will have nausea and vomiting. The patient might also have severe vomiting, so we have to give the patient an antiemetic. The domperidone dosage may be a 10 milligram. Orally could help. If it's severe vomiting, we have to give through IV, otherwise we can give orally. Next, we have to increase the water intake of the patient. If the patient could take fluids by oral, we increase the fluid intake orally. If the patient cannot take, he or she is continuously vomiting and having severe vomiting, we can give IV fluids to increase the fluid amount in the patient's body. The next thing we can do is we have to take blood and call some investigations as well. So we can order some baseline investigations such as like full blood count, and also with full blood count an essential investigation is you have to the organ that's going to affect by the stasis of urine. In case of a colic, ureteric colic obstruction is renal. So the renal function test is mandatory here. We have to assess whether the kidneys are reducing their function and kidneys capability of functioning is being reduced. So renal function test is mandatory, and also you can order full blood count like basic investigation. So the next step of investigations, we move into imaging. Imaging, you can do ultrasound KUB or X-ray KUB, or you can do non-contrast CT scan. These will be helpful. Basically, we do an X-ray KUB and also ultrasound KUB, which also detect the complications of the ureteric colic. And then we'll start the patient on a short-term antibiotic. This will also help the patient to reduce the chances of infection, and also as a prophylaxis as well. Thank you.